Hello, very good evening to all of you. Today we are going to discuss the case now of Miss Isabel Garcia. So this young lady is a second year university student who has the problem of bacterial meningitis. And she was referred to the emergency department doctor, that's you, by her general practitioner, Dr. Bradbury, and you treated Miss Garcia, and you need to update the health status and requirements of Miss Garcia to her own GP upon, and this letter is to update her condition, health status, and follow-up treatment that may be required in future. So this is our writing task. So here is it, to update her status and follow-up treatment that may be required in future. So writing to Dr. Lona Bradbury, Stillwater Medical Clinic, Stillwater. Now you look at the case, you know that this is the GP of Miss Garcia. So he or she knows, Dr. Bradbury knows the background information of Miss Garcia. I mean, about the fracture, weight gain, stress, difficulty sleeping, allergies, ongoing medications, family history, social history. All these things are known to the GP, and even the reason for the referral is known to the GP, because you know that GP knows the subjective data, because Miss Garcia has these symptoms for almost a week. So she must have definitely reported this to the GP, Dr. Bradbury. And that's why Dr. Bradbury has suspected meningitis, and that is the reason for the referral. So the presenting symptoms, that's painful, stiff joints, sensitivity to light, increased bruising, headache, neck stiffness, photophobia, rashes, all these things are known to the GP, that's Dr. Bradbury. And that's why he referred Miss Garcia to the emergency department. So that's what we have to understand. So after the presentation, after taking Miss Garcia into your care, you have examined Miss Garcia, and she had bruising in left arm, petechial rash, abdomen and legs, and a positive Brudensky sign. Now we have various blood investigations which were done, including LFT, full blood count, liver function, 10 C-reactive protein, lumbar puncture, and blood cultures. All these tests were ordered at admission, and the results of the hematology was an increased the white blood cells, white cell count was elevated. You can say C-reactive protein, and lumbar puncture, you have polymorphonuclear predominance, which indicates severe infection. You can see the blood culture. The blood culture, we have Neisseria meningitis. So we have the diagnosis as bacterial meningitis. So that's Neisseria meningitis. Now, what's the treatment we have? we started a ceftriaxone 2 gram intravenously till we got the culture report. So up till we got the culture report, she was on ceftriaxone 2 gram. After that, we started dexamethasone, the steroid 2. And this has to be continued for the next 4 days. And once we have got the puncture result, lumbar puncture results, that's we identified the organism, we identified the diagnosis. We changed the antibiotics to benzyl penicillin 1.8 gram. So, and this has to be continued for another 5 days. It's going 4 hourly a day. And you can see Miss Garcia is responding positively to the treatment. And we have reported this incident to the Department of Human Services. And we have discussed with the family regarding the immunization, regarding the problem, regarding the meningitis. Now, what we have to do is the discharge plan is to write a letter to the GP and recommend GP to contact close family members and friends who were in touch with Ms. Garcia, and seek medical attention as soon as possible if they develop any signs of unexplained illness. And you have to explore the possibility of chemo prophylaxis of people in recent close contact with Ms. Garcia. And this is what we have seen in the case notes. So as we are going ahead with the answer, we are not writing the date here because you know that the only date given here is 23rd May 2015, which is not the date of today because you have to wait for the culture result. She got admitted to the emergency department on 23rd May. But after that, we started ceftriaxone. Then we got the culture results after 1 or 2 days, 3 days. So it's not 23rd actually. So we have a date after 23rd, maybe 25 or 26. So we are not sure, as we are not sure about the date of writing this letter. We are not written the date at this just because the presentation is on 23rd and the letter is definitely written after 23rd. So we cannot write 23rd here. So we have not mentioned the date here. Dr. Lorna Bradbury, Stillwater Medical Clinic, 12 Main Street, Stillwater. Dear Dr. Bradbury. Okay, so we have to have a space here to address it. Yes. Reference Miss Isabel Garcia, date of birth 1st January 1995. I'm writing to update you the present health status of Miss Isabel Garcia, who requires your follow-up care and management. So this letter is being written to inform you or to update you the condition of one of your clients, Miss Isabel Garcia. She is recuperating from Neisseria meningitis. She is recuperating from bacterial meningitis elsewhere. Now we have written the purpose, and the purpose is very clear. The letter is written to update you the information regarding the health of Ms. Garcia. Right now, she is responding positively to the treatment of bacterial meningitis. This is what the purpose is. Now, how the first paragraph is written, because you are updating the data. We don't need to go ahead to the details which the GP already knows. So what we are going to focus on is what he doesn't know. So first of all, we need to start. I have received your patient. the Miss Garcia was referred to you. Okay, so I have to get an introduction. I have to get a starting point. So that's why we have written this phrase. Miss Garcia presented to our care with suggestive symptoms of meningitis after being referred by you on 23rd May 2015. So Miss Garcia presented to our care, yes, with suggestive symptoms of meningitis, yes, after being referred by you when on 23rd May 2015. Yes, that's good. On examination, there were rashes on the legs and abdomen and bruises of left hand. Bruises. Okay. So after the on examination, there were partial rashes on her legs, on her legs and abdomen. And along with bruises. Okay, it's a bruises on her left arm. She also had positive Brzezinski sign in order to make, okay, so she had difficulty in touching the chin towards the chest. So we have the test name there. So it was written like one word there in order to make the definitive diagnosis. So we have already the case suspected meningitis. We need to confirm the diagnosis. We need to get the definitive diagnosis. In order to make a definitive diagnosis, a series of hematological investigations were done along with a lumbar puncture and blood culture. So I have gone with the presentation and investigation. After the paragraph after that, which is highlighted in yellow, after confirming severe infection, which was evidenced by an elevated white blood cell count and polymorphonuclear predominance, intravenous ceftriaxone 2 gram was prescribed to Miss Garcia along with dexamethasone 10 mg. So we have started the first line treatment immediately after confirming her infection. So following her lumbar puncture results, her antibiotic was changed to IV benzyl penicillin 1.8 gram 4 hourly for 5 days. So when we got the lumbar puncture results, we got it confirmed that it was bacterial meningitis. So we started benzyl penicillin instead of ceftriaxone 2 gram. At present, she is responding to the treatment positively. Intimation regarding the condition was passed to the Department of Human Services and her family was counseled. Okay, it's not counseled, it's spelling mistake. Counseled regarding the significance of immunization. Okay, so the condition was reported to the Department of Human Services. Now, Ms. Garcia requires close monitoring and support following her discharge, including medication complaints. Yes, because she has some medications going on. Please contact her relatives and close friends and advise them to seek medical attention if they observe any signs of unexplained illness. If they observe any uh, complications, they have to report, and kindly consider giving them chemoprophylaxis too. So that's what we have the letter, the content of the letter. We have organized it into 3 paragraphs along with a briefly written purpose. And if you have any further queries regarding her condition, please do not hesitate to contact me. Yours sincerely, doctor. And this is the letter. Okay, thank you.